Banish cancer fear together. Are all cancer screenings risk-free? Understanding the realities. Most of us believe cancer screenings are always safe, always helpful, and always life-saving. It feels reassuring to think that the more we test, the more protected we are. But here's the truth. Not every screening is risk-free. Before you book your next test, let's unpack the realities together. Think about it. When you hear the word screening, what comes to mind? Probably peace of mind, catching cancer early, maybe even saving your life. And yes, screenings can do all of that. But no test is perfect. Some miss cancers. Others flag problems that aren't really there. And sometimes finding a cancer doesn't actually improve outcomes. That's the part we don't talk about enough. So let's break it down. Here are the main risks you should know. False negatives happen when a test misses cancer, giving false reassurance. Imagine walking away thinking you're in the clear, when in reality, something was overlooked. Then there are false positives, when results look abnormal even though no cancer exists. That can mean days or weeks of stress, follow-up scans, even biopsies, only to find out nothing was wrong in the first place. Overdiagnosis is another big one. This happens when a screening finds a cancer that never would have caused harm in your lifetime. But once it's found, it often leads to treatment, surgery, radiation, or medication that you didn't actually need. And then there are side effects. Most screenings are safe, but some carry risks, discomfort, bleeding, or in rare cases, serious complications. Here's a number that might surprise you. Over a lifetime, about 85% of women and nearly 39% of men will experience at least one false positive from cancer screening. That's a lot of unnecessary worry, and sometimes unnecessary treatment. Now, let's be clear, screenings save lives too. Early detection can be the difference between catching cancer at a stage where it's treatable or finding it too late. Lung cancer screenings, for example, have cut deaths by nearly 40% in high-risk patients. Breast cancer deaths have dropped dramatically over the past few decades, with screening playing a major role. Colorectal cancer deaths have fallen by almost half. These are powerful numbers. So how do we make sense of this? The key is balance, using the right test at the right time for the right person. Not every test is for everyone. Cervical cancer screening usually starts at age 25. Lung cancer screening is recommended for heavy smokers between 50 and 80. Colon cancer screening often stops after 75. And prostate cancer screening? That's a decision you make with your doctor based on your personal risks and values. The point is, screening isn't one size fits all. It's tailored, and that tailoring matters. So what should you do? First, ask questions. Don't just accept a test because it's offered. Ask why it's recommended for you. Second, weigh the benefits and risks. Remember, a test is a tool, not a guarantee. And third, keep the conversation open with your doctor. Shared decision-making, where you and your doctor decide together, leads to better outcomes and less confusion. At the end of the day, cancer screening is powerful, but it's not perfect. It can save lives, but it can also cause stress, false alarms, and unnecessary treatments. The key is balance, knowledge, and choice. So the next time you're offered a screening, pause, ask, learn, decide. Because informed choices are the strongest choices. Take charge of your screening decisions today. Banish cancer fear together. You're not alone.